It's all right. Hello, everyone. Good afternoon. We are welcoming you to the global dialogue on prevention of substance use disorders during COVID-19 pandemic. So here we have a panel of discussants today. We have very esteemed guests with. We have participants in the discussion from different corners of the world. We have Ms. Reema from Lebanon, Ms. Cindy from Malaysia, Mr. Augusto joining from Macau, and Ms. Amy from USA. Unfortunately, the host for today's session was appointed as Mr. Iqbal Masood, the director of the health sector and the global trainer for the global master trainer from Bangladesh. He is unavailable tonight because of his family emergency. So I am Tasnuba Humaira. I am also working in the Dhaka Asania Mission Health Sector in Bangladesh. I will be joining with all of you today for tonight's discussion. So at first, I would like to ask our discussants today to introduce themselves and just then we will start our discussion tonight on the topic. So first, I'm asking Amy to just say a few words about yourself to let us know who you are and who are you working for.
Great. Hi, like you said, my name is Amy Bronshausen. I'm the Executive Director of Drug Free America Foundation and also the International President of the World Federation Against Drugs. Drug Free America Foundation is a drug prevention and policy organization, and WFAD is a community of non-government organizations with the aim of working toward a drug-free world.
Thank you, Amy. We are very glad that you could join with us today. Cindy, can I ask you to say a few words about yourself now?
All right. Thank you, Tasnuba. I'm Cindy Biding from Malaysia, President of the Organization for Addiction Prevention, Treatment and Rehabilitation, which I myself founded last year in October. And I'm also a registered and licensed counselor and a global master trainer for treatment addiction professionals. Thank you.
Thank you, Cindy. Reema, I can see that you have wrote in the message field that you couldn't hear us properly. Is the connection better now?
Hello, I can't hear you clearly. Are you hear me?
Yeah, we can hear you.
So I'm Reema Auditor from Lebanon. I'm an executive director of Nusroto Association. Nusroto Association is treating drug users and abusers in its inpatient centers. And also Nusroto actually is re-educating juveniles referred by the Ministry of Justice and the Ministry of Social Affairs. And also we have a mental health center. We are receiving some cases referred by the UNHCR. And also I'm board member of World Federation Against Drugs representing Asia.
Very good to know that you could join with us today. And last but not the least, Augusto, can I please ask you now to say a few words about yourself?
Thank you. Well, I'm Augusto Nogueira. I'm the president and the CEO of the ARTM, Association of Rehabilitation Drug Abusers of Macau. ARTM stands for a community therapeutic, and we also have healthcare. We also have aftercare department, harm reduction department, and also we are Be Cool, which is a prevention project for the community in the schools. And besides that, I'm also currently the president of the IFNGO, the International Non-Government Organizations, with headquarters in Kuala Lumpur, Malaysia. And I'm also board of the member of several commissions of movements in terms of HIV and drugs. Yeah, that's it.
Thank you, Augusto. So, viewers, we have an esteemed panel of discussants here today, and we'll be discussing about the preventive measures for that we can take during the COVID-19 pandemic to prevent drug addiction. So let's start with the discussion. At the very first of the show, can I ask Amy about what is the World Federation Against Drugs has taken? Has the organization taken any specific initiative to continue their addiction prevention activities during COVID-19?
Sure. So World Federation Against Drugs is a membership organization. So we're made up of many NGOs from across the globe. So what we've kind of been doing in the last few months is being in better communication with our members to understand what challenges and needs they have in this new world, and to really seek out the different strategies that they're using that they've been successful with, and connect them with other members so that they can collaborate. So like most organizations, we have significantly increased our virtual footprint by hosting additional webinars, participating in great events like this, and then just also increasing our social media presence.
That's very nice to hear. So we know that prevention occurs through upstream prevention programs, policy interventions, misuse and harm preventions, as well as community-focused interventions, all of which are quite difficult during the COVID-19 pandemic. As an expert in the field, how would you prioritize this task at the current situation?
We're still on me? For us, COVID-19 has really I think that this situation has really forced the prevention community to think outside of our normal strategies. And honestly, I think it's been a really good challenge for us. Oftentimes we get really set in our ways of doing things, and this pandemic has really jarred us. For us, the basis of prevention is reducing risk factors and strengthening protective factors. And risk factors have significantly increased over this time period. And you have to understand that sometimes drug prevention, it also means just meeting people's basic needs. For example, when the schools were closed down, that might have taken away some of our youth's only chance to have a meal, or it might have been their safe place to be away from a substance using parent or a situation of violence at home. So we need to make sure that we're meeting their basic needs of food and shelter and safety. And that's really part of drug prevention, because if we can meet those needs and increase their protective factors, we really will significantly reduce their want to engage in substance use issues.
Okay. Now let's go to Cindy. Cindy, can I ask you, can I ask you that as the president for Organization for Addiction Prevention, Treatment and Rehabilitation, and as a treatment center owner, which support do you think are necessary to continue addiction prevention activities?
Okay, I think that before I talk about support, I would like to say that this has been a very challenging time for not just my organization, but for other treatment and prevention providers. So what we do is, even though we have been instructed to cancel our activities due to COVID-19 pandemic, we try our very best to engage the community, because most, if not all of our prevention intervention is actually focused on community outreach. So before COVID-19, we were going out to the communities, be it to school or be it to communities particularly in the rural areas, to the different target groups, children from 8 years old to 12 years old, teenagers, youth, and also parents. So the community as a whole, we meet them face to face. where we actually provide psycho-education sessions or sometimes workshops for smaller groups where we conduct life skills training and coaching. But with COVID-19 and the lockdown, in fact, we took some time to think about how to go about engaging the community so that they are engaged in something productive and something that benefits them rather than doing something else like going into drug or progressing into addiction for that matter. So what we do is online sessions with small groups, and this is really we find this really a limitation because in order to reach out to rural community, we need to have good internet access, stable and uninterrupted, which we actually are not able to do for the rural community. So that's really our shortcoming. So the online activities that we do are mainly with those living in town and near the cities. And then also posting on social media, Facebook, chat room about information, knowledge on self-care during this COVID-19 pandemic. So those are the few limited activities that we are able to carry out. And of course, a couple of days ago, we also hosted a webinar for Southeast Asia, again on COVID-19 and beyond, and the psychological impact on mental health. This is also a way to engage the community, not just our local Malaysian community, but in the region of Southeast Asia. So that was, and the support we need really is from our country, from our government, is better or improve or enhance internet access to a wider range of community. Thank you.
Thank you, Cindy, for being very elaborate and we are very clear about the challenges that you've been facing now. Augusto, let's come to you now. So firstly, as the president of the IFNGO of Drug and Substance Abuse, what do you suggest that such non-government facilities should do to continue their prevention and harm reduction activities during this time? One of our viewers also commented one similar question about that. What types of prevention activities are effective during this pandemic? So can I ask you to put some light on this issue?
Okay. Well, as president of the IFNGO, I'm sorry to say, IFNGO has not been very active during this problem of the COVID-19. But I do know that many of our members, they have been active, participating in different webinars organized by other associations. And then they also been active doing online prevention and basically what everybody is doing right now, right? So as a president of NGO, I suggest each NGO should have the initiative to organize their own initiatives, their own webinars, their own prevention methods that can adapt to the reality of their own country. In Macau, for instance, we have a very small region, so we are facing a completely lockdown through China and through Hong Kong. We cannot go anywhere. So it's bad because we are here. We cannot move much from this small place. But by other side, there was some positive situations like less drugs enter Macau, and those ones that tried to enter, they were very easier caught by the police, either by sea or some adventurous guys that try to bring through the board with a special pass. So So this was the positive from this, one of the positives from these lockdowns, of course. But that's the thing. As the president of NGO, I suggest the NGOs continue working and continue. Don't be expecting that the umbrella life NGO have the initiative, but they should have their own initiatives and either locally or in the regional or international. About the harm reduction, well, the thing is, people will continue using drugs. People will continue taking drugs, and this is either, and for instance, here in Macau, because of that lockdown, right? So lately, we didn't have many. In the last 3 months, basically, only 1% of the people that you are serving, we are serving in our needle syringe from. Only 1% they are injecting heroin. And the rest of the people, those ones that are injecting heroin, they switch and they start to inject midazolam, which is very normal here in Macau. They use the midazolam together with the heroin to give more strength to the heroin due to the bad quality of the heroin. So they start to injecting the midazolam. So actually, the effects of the midazolam make the people very conscious, very unpredictable mood, unpredictable violence. So we are working on harm reduction. We need to continue providing service for these people. We need to continue providing needle syringe. We need to syringe. We need to continue collecting the used syringe. We need to continue having nurse available to help them. We need to continue teaching them and telling them that injecting pills, it will be can be very dangerous for the veins. So our work cannot stop, and that's what will happen in our outlet of the harm reduction. When it was the main lockdown, we reduced our staff. And we just have 2 or 3 staff per day, and we only were able to provide a syringe to collect syringe. Now the things are much better because we have no new case of COVID for 80 days. So we are starting to be more easier, but we're still not allowing people to enter our facilities. But I'm very happy that because I've been following many situations happening all over the world, and I'm very happy to see that in Macau, we NGOs and the government, we have a very good cooperation, and we didn't cancel the main activities from harm reduction because we know that people are going to continue using, so we need to continue helping them. In terms of prevention, I mean, we are doing it like everybody else. We are doing online posts. We are doing drawing competitions online or through the service users of our default project prevention. And actually, even in harm reduction, our clients in harm reduction, we also did several competitions, like the take a photo from your window to see what your window can tell to you. We did also some cooperation with families of the people that are using drugs, also for them to take photos. We also wrote sentence what we're gonna do with this, we have judge that is the people that are in recovery, they are in the treatment center, they are the judge, and then the winners, we're gonna print the t-shirts or the caps, so we can offer to the government and to the other institutions to fight the stigma. So basically, that's what we've been doing. It's a little bit of everything. Even in aftercare, we follow people that they are in probation from the government, from the prison. So we still doing the worst part of the COVID. We made online consultation, phone calls consultation. Now we start already face to face with the masks, all that stuff. But need to have a previous early appointment, and then we can have the face-to-face counseling. So slowly in Macau, the things are starting to come up, but we are just finishing make a proposal, not a proposal, but kind of a project which we call the stage 1 for the COVID, and then we're going to have the stage 2 that will allow some certain number of people going into our facilities, and hopefully, if nothing happens, around July we can go to stage 3, which means open everything goes back to normal life. But all that also depends what's going on in China and what's going on in Hong Kong. So, but basically, I think more important is that we need to be very creative in these moments, not only us as the responsibles, but also to make our colleagues and staff to be motivated and to brainstorm for ideas that we can develop and to help people. Thank you.
Thank you, Augusto, and congratulations that Macau has almost recovered COVID-19 crisis. Hopefully, it will just get better from here.
Also, it's better holidays.
So, Reema, now. Reema, now let's come to you. I can see that you're facing some technical problems. Just feel free whenever you get disconnected, just join with us again by clicking the link, and then we can continue discussion. So Reema, my first question to you is that how is the pandemic influencing the rate of substance use in Lebanon?
Sorry, I can't hear you. All words are interrupted, but if you are talking about prevention, I guess.
Well, I was asking about how is the pandemic influencing the rates of substance use in your country, but we can talk about the prevention activities that is going on in Lebanon as well. I think Reema's screen is again frozen. From the discussion that we were having, I can understand that most of us are using online platforms now for counseling and prevention activities. So in Bangladesh, we've been using the same platforms for these kind of activities as well. We're posting motivating messages and informative texts in social media. We are publishing leaflets, and from our treatment and rehabilitation center, we are trying to disseminate the knowledge, the information to the patients' families as well. So it's my open question to all of you. Do you think that these measures are actually essential and actually enough, adequate for the prevention activities that we have to follow on after the COVID-19 crisis? So about the continuing the online activities through social media posts and leaflets and telehealth, telecommunication to the patients' families, along with the recovery patients. Do you think these are essential and adequate to continue the prevention activities?
I think that they definitely, I think that this COVID-19 has given us the opportunity to, in one hand, reach a wider audience. So with the new things with telehealth and our virtual classes, we might be able to engage people that we haven't been able to in the past. Because, you have a little more anonymity when it comes to doing things virtually. And I think with telehealth, maybe people who were afraid to take that first step might use the telehealth as an easy way to get into treatment or prevention and recovery. However, and I think that these things should continue, but you just really can't lose the value of those face-to-face interactions. And like what Augusto said about the harm reduction activities, those are things a lot of times that you're in the community. And what Cindy said when she was talking about the youth prevention that they do, meeting with the youth and being out inside the community, you're never going to be able to get those same connections virtually. I think that we can use these to enhance, and they're definitely a Band-Aid for now, and I think we should continue them. But I'm very hopeful that we can get back to what we were doing before and then use all these new strategies that we've been having to enhance the efforts that we're doing now.
Sounds good. Now, this brings me to Cindy. Cindy, we know that you've you are an expert on the treatment curriculum for addiction professionals. So COVID-19 has brought an unprecedented experience in front of us. As an expert on the curriculum for addiction treatment, do you think that we need to rethink this scenario and include it as a guideline for addiction professionals about what to do when such calamity occurs?
Yes, definitely so. You're asking if we need to rethink of what we are doing in this scenario. I would say that actually this COVID-19 pandemic has opened an opportunity for us to look at the things that we are doing right now. Because even though we are responding, we are not, for us in Malaysia, for example, we are not responding as quickly and as effectively as we need to, as we should actually, to cater for the need of so many people. Um, so I would say that yes, we definitely need to rethink and see what are the necessary things that we need to do to pave the way forward for post COVID-19, and also in the event another pandemic of this nature would occur. So I would say that countries and governments need to come up with a mechanism to assess the state of mental health of our providers, treatment and prevention providers. And why do I say this? Because all of us are affected, including providers. So we as providers need to be in a good mental state before we can actually care for others. And this is why I say that there need to be a mechanism to be put in place to look into the mental health of ourselves, we as providers, and to provide intervention to ourselves, for ourselves, just like the healthcare professionals, for example, the frontliners who had been taking care of COVID-19 patients themselves. The fear, the anxiety, and the worry that they too might get infected causes a lot of distress. So I would say that yes, we need to take care of ourselves as providers so that we are in the best mental state to care for others, whether it is prevention or treatment intervention. And I would also say that in order to come up with this mechanism, there need to be a collaboration between government as well as private sectors, as well as the relevant NGOs, to work together and bring this initiative together, come out with an SOP. How do we provide prevention and intervention? Prevention and treatment intervention during a pandemic like COVID-19, or even during recovery of for COVID-19. Um, and in doing so, we need to take into account um, inclusive communities. We cannot leave anyone behind. So I was earlier just now, I talk about rural communities. They are very difficult for us to reach out to because of the sometimes, in some cases, the non-existence of internet connection, and sometimes when there is internet connectivity, it is not reliable, it's not stable and interrupted. Or sometimes if there is good internet connectivity, do these people have the devices to use to 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 reach out to us, or for us to reach out to them at this time when we are locked down, when we cannot move around, and social distancing and all these kind of procedures during lockdown. So yes, those are the things that I want to say. that we need to relook at how we are going to work more effectively in providing our services during a pandemic like this. Thank you.
Also, do you think that addiction professionals require specific training on how to use these online platforms for providing services for addiction treatment and rehabilitation?
Yes, I would think that the majority of these people would know how to use, but I cannot assume as well. So I
No,
think
not the
yes,
technical
training.
stuff. I was yes, I was
Uh-huh.
more worried about how to provide the correct counseling, because as far as I know, that counselors often read the physiological markers and habits and the body languages of a patient when they're providing counseling. So these are quite difficult through any online platform, through tele support or through Skype,
Right,
Zoom, or any other
right.
online video platforms.
Mm.
So do
I
they
would
require
say,
special
Mhm.
training?
Yes, of
Yes, please
course.
continue.
In providing services, especially for treatment, we do need another form of training. For example, very simple like mental health first aid training or psychological first aid training. These are very basic and really important for providers to be able to get used to or to be knowledgeable about, because telecounseling, as you said just now, is not the same as when you are face to face. You can look at the people's expression and their movement and so on. So, in fact, for some people, telecounseling may not be really the term, but it is just listening, to people who are calling in and giving them assurance of certain things. Or people may just want to know how to get things done or where to go, especially during this time of COVID-19 pandemic. In Malaysia, we actually have a hotline launched by the Ministry of Health, where anyone can call in about anything. And we found out that 1/3 of the calls actually were psychological related calls. So it is not necessarily that we need to provide so-called telecounseling, because the person may not necessarily want counseling, but just want someone to listen to hear
Here,
him or her. Yes, to be heard. They just want to be heard at times. Do I answer your question?
exactly. Yes. Thank you. Thank you so much. Now let me go to the viewer's question. Sheila Rui Marquez asked us a question that, do you foresee any risk in extensively using online platforms to provide services for the people who use drugs? Augusto, let me come to you. Can you please elaborate on this question? Do you foresee any risk in extensively using online platforms to provide services to the people who use drugs?
Well, like Amy was saying, it's of course it's much better to have the face-to-face and to have the physical contact with the persons, where we can elaborate and a better support and a better support and if it's more in touch with the person itself than we've been just online. And I'm afraid if we start just to using these online platforms, then instead we have something that can be more cozy, more more human. We start to have something more cold and more far away to between us and the person in need, right? And so I think we need to be very careful, and it's important. And the COVID gave us this opportunity for us to have this this new platform to help the people, to assess the people. But I think there's nothing better than we being more close to the people and give our heart, and the people can feel the way we talk, the way we look to them, than just we hide behind the camera. So I'm afraid if we start to use we overdo these camera things, people get boring, and we start to be lazy, let's say, in helping the people in our approaching to the people. So I think it's good we be prepared for the future situations if epidemic. Hope not. We prepare. We know now how to do the things, but I think it's much better to have the human contact. So yeah, I think. I hope we don't take this as platform as the new and the most or the better way to help the people, because I don't think so. It is.
Okay, Amy, let's come to you now. So we have seen that World Federation Against Drug gathers information, plans different preventive activities, and then promotes the prevention activities to different countries, different member countries, to continue their work. So do you think there would be any potential implication? What could be the potential implications of COVID-19 on regular addiction prevention activities?
So I think what you're asking is, how is this impacting what we're currently doing, or like our future activities?
Yeah, how will the COVID-19 crisis put impact on the regular addiction prevention activities, and how will these activities be modified?
So it's really hard to say. I think that we are moving forward with some of our regional conferences and things that are planned for months and months in the future, and fingers crossed that we'll be able to be together in person and do those things. But at the same time, we have seen the need to connect virtually and figure out what's going on there. But that is also really problematic, because as Cindy was mentioning, and as we are witnessing ourselves with Reema's connection, sometimes it's really difficult to do these virtual platforms, especially in, rural areas and areas that just don't have the facility to do this. So I think that, moving forward, there's a few things that we have to kind of advocate for. I think one of the things is that, we've seen that governments all over the world are coming together to test and track and trace the COVID-19 infections and cases. So how can we build off that? Can we somehow integrate our response for the COVID-19 with substance abuse prevention and treatment efforts, so that while we're tracking this disease, we're also looking at mental health and substance use disorders? Unfortunately, the news in the US is not as good as it is in other places in the world. This pandemic hit us at a time when we were already experiencing a devastating opioid epidemic. So now you have the repercussions of us being isolated and people not being able to get their medicated assisted treatment, or not being able to get naloxone. And couple that with the fact that our government sent out stimulus checks that were much needed for people, but also could have been used as a trigger with this money that's burning a hole in their pocket to go out and purchase drugs. And we've seen, not yet, the statistics aren't out there because it takes months to get those, but we have seen that after that first round of stimulus checks, we've had 30 states in the US report that they've had significant increases in opioid-related overdose deaths. So we just are kind of at being hit by all directions with this. And I think that if we don't advocate for our governments to not only use all of their financial resources to address the COVID-19, but to share those financial resources so that we're addressing what is going to be a second and probably just as deadly wave, where we're seeing an increase in overdoses and an increase in suicides because of the mental health issues, not just with people that are currently experiencing a substance use disorder, but people who are now initiating into drug use because of desperate times, but also, as Cindy mentioned, the people that are working in this field and the anxiety and depression that we all feel as we kind of feel helpless, and how do we get to these communities and how do we help these people, coupled by the fear of getting COVID-19 ourselves.
True. Okay, so we talked about stigma and the healthcare facilities being burdened with COVID-19 patients. So, Cindy, my question to you is that persons with SUD are already marginalized and underserved by the healthcare services in many countries, largely because of the stigma that we talked about. Much of this stigma is based on erroneous but persistent belief, widespread even among healthcare workers, that addiction is the result of weak character and poor choices, whereas science has clearly shown it to be a disorder arising from brain circuitry alterations. When hospitals are pushed to their capacity, there is added danger of persons with SUD being deprioritized for care if they present with COVID-19 system. So in this scenario, what is your organization doing to promote such positive behaviors for the treatment of SUD patients? Cindy, your microphone is muted.
Sorry, I muted it. Yeah, I think if I get you right, you are asking what are we doing to help minimize stigma? Is that what you are asking?
Yeah, so in this COVID-19 scenario, when a patient goes to the healthcare services, they are prioritized based on triage and other clinical facilities. But if the healthcare workers are sometimes, even the person is a SUD, he or she might also think that I will not get the proper healthcare services because I am a drug addict and I would not get the services. The doctors will not see me, or they might think that I am already a very disappointing case, so I wouldn't get the proper treatment. And sometimes due to the high patient load, the SUD patients are also get deprioritized for care, even if they present with COVID-19 symptoms. So to reduce these kind of stigma, especially during the COVID-19 crisis, is your organization doing anything specific to promote positive behavior?
Yes, well, actually, we have been doing this even before, but now, yes, so we are, as I say, posting positive information in order that people do not, especially those under treatment for SUD and recovering from SUD. Before COVID-19, we have already been telling them that you're not an addict and you're not a recovering addict. You are a recovering person. We try our very best to not let them use the word addict or recovering addict. So many are learning to take themselves as a recovering person and not a recovering addict. Well, how can we disseminate information constantly and consistently to larger range of people in this time? We cannot. We can only do that to those who are accessible to the internet connection. So like we said just now, on social media, and sometimes we do chats with them. So like I said, it is really a difficult time, even if we want to do training, like building confidence or self-esteem. There are certain things that we need to role play with them that we cannot do it in such a training unless we have excellent videos to show them. Again, like Amy mentioned just now, we cannot what do you call compromise human touch. That was what Augustine mentioned also. So it is a trying time, yeah. Our limitation is there, and we acknowledge that we haven't done very much in terms of reaching out to more people in terms of treatment intervention as well. So because those who really need immediate treatment, treatment facilities, by the way, have stopped receiving inpatient clients even before the lockdown started. And then treatment facilities are only receiving outpatient. Again, try to minimize, because even staff are limited to the essential staff, that is only the clinical team would go to work. And then if need be, if the client really need counseling, we also have to comply with the SOP, like the wearing of personal protective equipment and taking the temperature, sanitizing, and all these things. It makes it inconvenient, actually. So, yeah, we have done something, but we haven't done very much. I have to acknowledge that. Thank you.
But still, there are a lot of scopes to improve our activities and plan accordingly. Augusto, can I just ask you that we know that Macau is a very famous tourist attraction, and it has previously experienced a variety of substances for abuse. Local people also got affected by these. Although the social distancing and travel restrictions during COVID-19 have some positive impacts, as you have said, regarding this particular issue. So, what do you think that it should be the ideal plan to continue limiting this exposure of the local people to these substances, these foreign substances, and multiple accounts of substances when everything will resume again?
Well, Macau, as you say, it lives from the tourism, and basically we live from the people spending money in the casino. So if no people coming to spend money in the casino, we're going to have a big problem in Macau because we don't have any other economy. So that's sad, but it's the reality. With this COVID, we already can start to see a lot of business closing down, restaurants in the hotels closing down, and yesterday just one of the biggest shows in Asia, the Dancing in the Water, just closed down. So almost 100 people they were just fired. So I mean, if we're going to continue with our borders closed, it will be a very big disaster for the economy. But I don't think it's only for Macau, but for all over the world, right? Macau worse because we are very small, a very tiny place. So I mean, it will be and also for us, it will be very bad because we survive with a subsidy from the government. So if they decide to start to cut, so it will be very difficult for us to survive and to do our job. So we need to face the reality that one day when they're going to open the borders to everyone, so everything will come back to the normal, and more people start, those ones that they are, let's say, now having some kind of breaking in using drugs, they'll start to use drugs. Other ones they took this moment to ask for help for treatment. Other ones they eventually they quit by themselves eventually. So it's we don't know if they're gonna restart or not. But it's probably that the things will come to a normal, and with the normal comes the good and comes the bad. So there's nothing much we can do, just to continue working, and now. At least we improve our online platforms, our websites, and our way to achieve the people. So hopefully this we can achieve much more people and to alert more people and to have our facilities, our prevention methods and etc. More widely for everybody can see and can ask for help. But we cannot. We cannot. It's to be impossible. Actually, Macau, despite that a lot of people coming over here every year for gambling, we don't have many. We don't have a big situation of drug here in Macau. Actually, we only have around registered by the government. We only have around 600 people registered in our social fair. 600 people using drugs. Most part of these ones, they are heroin users and methamphetamine and ketamine. So we have a small population using drugs. And there's increase of there was a slight increase lately in the cocaine, people using cocaine. Some they are expect, some foreigners using and also among the youth, their local youth, they are using cocaine. We were facing a situation before the COVID. It was many young people, minor age. Actually, they were coming from Hong Kong to Macau to sell drugs. They were tricked by the dealers saying that you go to Macau, you are minor age, so nothing going to happen to you. But it's not true, because the people can be sentenced to the minors age institute. That's more kind of a prison for the minor age. So now with the COVID, this situation not stop, but that doesn't mean in the future can happen again. The thing is that we will be eventually will be more. The government, at least the police, will be more prepared, and we NGOs that you're preparing a lot of activities and regarding prevention and with the Hong Kong partners to tackle this situation. We can resume because we have to stop everything. But I'd like to say something about the treatment that even when it was the worst situation here in Macau, we didn't stop to receive the people. We minimize our staff, but we prepare one room, one section in our center just for any person that will come to the center to recover from drugs. So we have this, and we make our internal measures. But we never say no to the people. So it's as heavy say it's kind of scary, because even us we're scared, and to get the COVID in our family, we go home and the family is scared. But we try to minimize the possibility dangers to be infected. And as a harm reduction, we minimize it, but we continue. So sometimes it's I think it's the risks, and if we take this job, so we also need to take the risks. Otherwise, we better change job. That's it. Thank you.
Thank you so much. One of our viewers commented that his name is Muhammad Rubayat. He's from Bangladesh. He commented that he strongly agrees with Cindy on the fact that the mental care of the frontliners, such as healthcare professionals, should be taken into consideration. Government and private sectors can jointly play a meaningful role in such calamity. That we all agree on this. We have viewers from Philippines. We have viewers from Bangladesh, many viewers from Bangladesh. Also, there is another comment from one of our viewers that he said that in the aftermath of COVID-19, there will be more mundane challenges. It will then require more resources and, of course, more compassion from society. Let's hope we are going to see a better understanding from those on the top. We all hope that for that to happen. Many viewers congratulated us and welcomed all the guests for a great discussion and participatory discussion. So we are almost at the beginning, at the end of our discussion show today. So my last question to Amy is that what is the official message from the Federation, from your Federation, for its members regarding the prevention activities to run during COVID-19? Amy, your microphone is muted.
Sorry about that. I think that probably the biggest thing is, and I've heard this is not, I did not come up with this, I'm stealing this from other people, is that, we really have to move from this mindset of being socially distant to being socially connected. This pandemic has, created the greatest forced isolation that's ever happened in our modern history globally. And, we've talked extensively about it today. It's just, all prevention, all treatment efforts, all recovery efforts, they really require us to stay connected socially. So to encourage more events like this, to continue to reinvent how we collaborate with our members until the day where we can all be together again. But then remember all the things that we've been doing during this time period to enhance our other efforts. And really, I think that this is an opportunity for us to advocate for government policies that we've talked about, to invest in more mental health and treatment services and recovery services and prevention services, which always seem to be at the bottom of the barrel when it comes to funding. So really showing that, this pandemic has, really exacerbated those issues, and we're going to need significant funds in the aftermath, as one of our viewers said, but also to invest money in infrastructure so that we can continue to reach people virtually in our rural areas and in our minority communities that might not have access to a computer. There might be Wi-Fi there, but maybe there's not a computer or a smartphone in the house. So continuing to advocate for policies that allow us to reach as many people possible.
Yeah, thank you so much, Amy. And now I'm going to Cindy for her message with your context and experiences of being involved in Malaysian drug treatment and prevention situation. What do you suggest for South Asian countries to do to, promote better prevention activities in their own?
Thank you. I would say that it is good for countries in the region to work together and come up with strategies that are able to enhance, that will be able to enhance our prevention initiative. For example, governments in countries need to create, if they haven't had any, which I believe not many countries in our region have it, this rural community crisis or rural community crisis center, or whatever you call it, something similar like that, because during a pandemic like this, we find that people in the rural communities really are the ones who need help, because there are some people out there, a lot of people out there whom we do not know, actually economically and financially disadvantaged, and this situation has actually made them so distressed. And of course, what do? Some want to commit suicide, or some go into drug use, and this is really a very sad story. So if we can create this kind of rural health community
Center,
rural
health,
health, or rural community crisis center, in order to cater for the need of the people, because they are the ones who would know how to reach out to them, understand their need and their cultural sensitivity, while we here in the cities, in the town, are not able to reach out to them and may not really understand their need. So I think that is one thing that all countries in the region need to think seriously about, and perhaps if any country had already had it, then other countries can emulate that example or use it as a benchmark. Thank you.
Thank you. And Augusto, at the end of the program, we are coming to you. So as the president of the INGO, what would be your message to the non-government organizations who are working in the field of addiction prevention? What would be your message to them to follow during COVID-19?
I think it's to continue developing activities and activities of prevention activities to not stop. To continue to be involved in the online webinars. I mean, to not lose the track among ourselves. But I think the more important is for the Southeast Asia as well, that we understand that it's time for us now to also work with our governments to achieve a consensus and to stop to using this silly thing of the zero tolerance, because we know will not happen. And it will be much better, much better for us and for the people that we are helping to have a real situation, a real not a dream of the zero tolerance. Because we could see what COVID make. COVID make a lot of people don't have access to the treatment. We saw also many groups trying to alert the governments to release people from the prison because of the COVID. So a lot of situations are happening currently in Southeast Asia. We also have other groups trying to use this moment to say that untrue things, like people have no access to treatment, people have no access to harm reduction, people have no access to drugs. A lot of situations that they are not reality, they are happening to everybody. So everybody have agenda. So it will be very good for us in the Southeast Asia, together with the Regional Office of the United Nations, to achieve a real consensus and to fight and to help those members from the Southeast Asia to improve their infrastructures of treatment, infrastructures of prevention. And I think we NGOs, we can have a very good impact on that. We have the knowledge, we have the technique, and there's a lot of NGOs here that can help the governments globally can help the governments to achieve that. And I think that is the more important. We should not stop. We need to continue working very hard, not only for our own region or country, but also globally, to have for the Southeast Asia, at least have a different view from the Western countries and from all over the world, that they see us as the place where we're still having the mandatory treatment centers and slavery treatment centers, all that stuff. So that we, in this moment, I think it will be we could emphasize and work with the governments to change that.
Thank you. So here we are at the end of our discussion tonight. We missed Reema Auditor from Lebanon. I think because of the technical difficulties and network problems, she couldn't join with us for the whole time. I have taken some points from our discussion, and we will be having an internal discussion in our office. Because we run 3 drug treatment and rehabilitation centers, through which we have been running many prevention activities throughout the country. And we will, of course, keep in mind the valuable points that you have shown before us. And our viewers and I thank you for this very participatory discussion tonight. Thank you very much, all.
Thank you.
Thank you.
Thank you.